I think one, I spoke to you, the problem is our people are not trained. So I think we'll spend more time, DHA must spend more time training the people. But what the governor of Elgeyo Marakwet said is true. Sometimes some of our staff are very lazy. So they blame, he doesn't want to do the system, he says Shah is bad. But colleagues, let me be very honest with you. This morning, a facility in one of the counties has been flagged out. Just because that facility said it has done 10 surgeries. And the name of the doctor is in a different county, 1,000 kilometers or 500 kilometers away. And we talked to the doctor, he said, I have never been to that county. So there's a lot of fraud. And I'm telling you, we're going to deal with fraud. This system we have put is fraud. This is one example today. We are not waiting. Right now, it's under investigation. Kenya Medical Practitioner Dentist Council, we are meeting with the DG and the PS. They are compliance officers. They cannot take bribe anymore to register a facility that doesn't exist. They cannot change the level of a facility. It is not going to be business as usual. I mean, we are leaders. You heard about the person, the doctor who performed the hip surgery. In one day, he did 10. And I'm sure the doctors are telling me a normal proper hip surgery will be in the theater between 8 to 12 hours. But he did 10 in one day. He must be a superhuman. So we are finding out that, you know, some of these cases is not my business. Some of these cases, we will refer them to the agencies that are responsible, the criminal justice system. So we will be sharp. So we will help you now. So I'm just dealing with the general. Chair, I want to ask the governors, how fast and how immediate first you can do a head count of how many are in your 47 counties?
We already have the numbers.
We have the number, we have the names of those on ground and the absentees. We can give that in a day.
So once you give me that, the money will be transferred to you people. Even if you give me today, tomorrow the money will be transferred to you. Am I right, my friend? Right. We don't need National Treasury. I don't know why they were keeping the money in MOH. But I want to know the number, so that we want to know in every county how many have left, how many are working, and because of accountability and transparency, I will be very, very happy that a proper head count is done. And I have agreed that with the union. Okay? Once we do that, then I'll send the money. But even you, good governors, through the chair, there was a public service guidelines and there was a summit resolution which you are to absorb, because these people work for you. Even now, you know, it is very, I mean, I can't understand, and I agree with the governors, that the contract between the UHC staff is between the county governments and the UHC staff. But when it comes to paying, another level of government is paying. That I agree with you, and I have no reason. The PS is here. I ask him, why are you keeping this money? So we'll give you this money. But the next question, the elephant in the room, is that there's a summit resolution you have agreed with the president to absorb them under permanent and pensionable. That was a summit resolution. It was.
When given resources.
When given resources, it wasn't unavailable.
No, I'm coming to it. Now we are giving them 50 for those who have degrees. We are giving 40 who have certificates. So under the SRC guidelines, once they become permanent and pensionable, their salary will increase. That is now the matter we now need to discuss with the National Treasury. And I am ready to lead the way to that meeting. But you agree with me, after we do the audit, you also allow me that we will engage SRC, will engage Treasury, and then you will absorb those who are working in your counties. And we have the right number. That's number one. I think
Let me help you there.
there was a time frame. Chair and colleague, good leaders here, governors, we need to bring closure to this matter. These people should not be in the streets. For if, and I'll repeat it, for us to make sure that universal healthcare works, the health human resource is very critical. We can deal with the digitization, we can deal with the cancer reforms, we can deal with the who are quacks and the doctors who treat our people, we can deal with many. And Chair, I forgot to tell you that this system is integrated into the National Registration Bureau. So the person you are treating will be known first he is alive and he's a Kenyan. So I think next they are going to the birth certificates. They even have a way how they can deal with the teenage mothers. There's a way even the Kenyans who have no ID can register SHA. All these are information which have never been explained. But I want you to help me as we go to Treasury. The message that will come, and I'm going to send it, I'll be asked, is that universal health UHC staff, first, they will go back to their counties. The money will be transferred to the counties. They will be given permanent and pensionable, as we discussed the increment, which is 3.5, with the SRC and the National Treasury. I think we will agree on that.
Chair.
And,
Chair.